Your blood pressure target at 70 should not be the same target that was designed for somebody who is 40. And that single misunderstanding may be one of the biggest reasons so many older adults are either being undertreated, overtreated, or living with symptoms they were told to ignore. Because once you reach your late 60s and 70s, the question is no longer just, is your blood pressure high? The real question becomes, how low can it safely go in your body without costing you strength, clarity, balance, and blood flow where you still need it most? That is a very different conversation. And if you are 70 or you are taking blood pressure medication in your 60s or 70s, I need you to hear this carefully. A reading that looks perfect on paper can sometimes be the exact reading that makes you lightheaded in the kitchen, weak in the shower, unstable when you stand up, foggy in the morning, or exhausted for no obvious reason. In some people, the number that gets praised in the clinic is the same number that quietly makes everyday life more dangerous. Today, I want to show you why that happens, what changes inside the body as you age, what most people are never told about the top and bottom number after 70, and what a more realistic blood pressure target should actually look like if your goal is not just living longer, but staying steady, sharp, and independent while you do it. And by the end of this, I'm going to share one of the most important things adults over 70 on blood pressure medication need to understand when lowering the number further may stop helping and start hurting. Let's begin with the mistake almost everyone makes. Most people are taught to think about blood pressure in a very simple way. Higher is dangerous. Lower is better. End of story. And when you are younger, that logic often gets you pretty close to the truth. If you are 35, 40, 45, and otherwise healthy, persistently elevated blood pressure is something you absolutely want to address. Over time, it raises the risk of stroke, heart disease, kidney damage, and vascular injury throughout the body. But the body at 70 is not the body at 40. And that matters because blood pressure is not just a warning sign. It is also a delivery system. It is the force that pushes oxygen and nutrients to the brain, the heart, the kidneys, and every tissue that still depends on consistent circulation. So once the body changes with age, the best number is no longer just about lowering damage. It is also about preserving flow. That balance is everything. As we get older, the blood vessels do not stay soft and responsive the way they were earlier in life. The large arteries gradually become stiffer. They lose some of their elasticity. They do not expand and recoil as easily with each heartbeat. That one change alone alters how blood pressure behaves in a 70-year-old compared to a 40-year-old. When vessels are stiffer, the top number, the systolic pressure, often rises more easily. But at the same time, the bottom number, the diastolic pressure, may not behave the way people expect. In some older adults, the bottom number can drift downward even while the top number remains elevated. That creates a wider gap between the two numbers, something called a widened pulse pressure. And that gap matters far more than most people realize because that bottom number is not meaningless. The heart itself gets much of its blood supply during diastole, during that resting phase between beats. So if treatment keeps pushing the systolic lower and lower, but also drives the diastolic too low, especially in an older adult with stiffer arteries or coronary disease, you can end up with a number that looks controlled while the actual circulation story is becoming more fragile. This is where the conversation gets more complicated than the usual advice. Imagine two blood pressure readings. One person is a 138 over 82. Another person is 138 over 62. On the surface, people look mostly at the 138, but these are not the same cardiovascular stories. That lower bottom number in the second person may be telling you that the vessels are stiffer, the pulse pressure is wider, and the body may be less tolerant of aggressive lowering than you think. This is why age changes the meaning of the numbers, not just the numbers themselves. There is another change that happens with aging, and this is the one that catches people off guard. Your body's ability to adjust blood pressure quickly from moment to moment becomes less efficient. When you are younger, you stand up, your nervous system reacts fast, the blood vessels tighten appropriately, and blood keeps moving to the brain with barely any interruption. At 70, that system may not respond as quickly. The reflexes are slower. The vessels are less flexible. The reserve is lower. That means the number you see while sitting quietly in a chair may tell only part of the story. The real problem may happen when you stand up from bed in the morning, or when you get out of a hot shower, or when you skip lunch. or when you are slightly dehydrated, or when you take your medication and then do a little too much around the house. Suddenly, the blood pressure your doctor was happy with is no longer enough to keep you feeling steady. That is when older adults start saying things like, I don't know what's wrong with me. I just feel off. They say, I'm not exactly dizzy, but I feel weak. Or I get this strange washover feeling when I stand. Or I feel fine sitting down, but once I start moving, I'm not myself. And too often those symptoms get blamed on age, when in reality, they may be a blood pressure target that is simply too aggressive for that person's physiology. This is where I want to slow down and make something very clear. High blood pressure still matters at 70. It absolutely matters. I am not telling you high readings should be ignored. Over time, uncontrolled hypertension still raises the risk of stroke, heart failure, kidney problems, atrial fibrillation, vascular dementia, and serious cardiovascular disease. That part does not disappear with age, but what does change is the way risk has to be measured. At 40, you can think more simply in terms of future damage. At 70, you have to think in two directions at the same time. You still care about preventing long-term damage, yes, but you also have to protect short-term function. You have to ask whether treatment is affecting balance, stamina, cognition, standing tolerance, appetite, energy, and independence right now. Because for a 70-year-old, the harm is not only a stroke 10 years from now. The harm may also be the fall next week, and that trade-off is where one-size-fits-all medicine starts to fall apart. Let me give you an example. Picture two different 70-year-olds, both with a blood pressure of 148/78 in the office. The first person is active. They walk most days. They garden. They sleep reasonably well. They are not falling. They stand up without symptoms. Their home readings are fairly consistent. Their medication does not make them feel weak or foggy. Their kidneys are stable. Their memory is good. For that person, bringing the pressure down modestly may make excellent sense. The benefits may be real. Stroke risk may fall. Heart strain may improve. Long-term vascular protection may absolutely be worth it. Now picture the second person with the exact same office reading. They are also 70, but their body is telling a different story. They already feel unsteady. They have lost weight. They get lightheaded if they stand too quickly. They are on multiple medications. Their appetite is not great. Some days they seem mentally slower until afternoon. Their daughter worries they are more cautious on the stairs. They tell you they feel washed out after taking their pills, but because the clinic number looks good, nobody pays enough attention to what that symptom is trying to say. For that second person, forcing the number lower can be a completely different risk calculation. The medication that protects one 70-year-old may be the same medication that puts another one on the floor. Same age, same reading, completely different target. That is the point most people miss. Blood pressure treatment is not just about the number. It is about the number in the context of the person carrying it. And I'll tell you something else that matters. Many of the blood pressure targets people hear repeated over and over come from studies built around broad populations, but the frailest older adults, the most symptom-prone older adults, the people with repeated dizziness, multiple illnesses, balance trouble, or complicated medication burdens are often underrepresented or excluded in these studies used to shape the strongest treatment narratives. So when somebody tells a 70-year-old, everybody should be aiming for the exact same number. That sounds simple, but physiology is not simple. Function is not simple. Aging is not simple. If this is already changing the way you think about blood pressure, take a second to subscribe, because most older adults are still being told the conversation ends at the cuff reading, and it does not. My goal is to help people understand what the number means inside a real aging body, not just inside a guideline chart. Now let's answer the question directly. What should your blood pressure target actually be at 70? The honest answer is that there is no single perfect number for every person who turns 70, but there is a much smarter framework, and for many people, that framework is more useful than memorizing a universal target. If you are 70, generally active, not frail, not getting dizzy, not having falls, tolerating treatment well, and your standing blood pressure remains stable, then a systolic pressure in the low to mid 130s can be a very reasonable goal for many people. Staying under 140 systolic is often a practical and sensible target if it is achieved without symptoms, without weakness, and without driving the bottom number too low. That last part matters because at 70, it is not enough to say we lowered the top number. You also want to know what happened to the bottom number, how you feel, and whether the body support it needs when you are upright and moving. For some adults at 70, especially those who are fit and tolerating medication beautifully, numbers in the low 130s may be perfectly appropriate. For others, especially those with dizziness, falls, orthostatic, drops, low body weight, frailty, or symptoms after medication, the safer and more functional target may be higher, sometimes in the upper 130s or even low 140s, rather than pushing relentlessly toward a younger person ideal. And that is not failure. I want to say that again because many people feel ashamed if they are not hitting the textbook number they have heard their whole lives at 70. A blood pressure target that protects your brain, your heart, your kidneys, your balance, and your ability to live independently is not a compromise. It is the correct target. Sometimes the smartest number is not the lowest number. It is the lowest number your body can actually tolerate. Now let me add another piece that almost nobody explains properly. When people talk about blood pressure, they usually obsess over the office reading. But for many adults over 70, the office reading is often one of the least useful numbers if it is the only number being used. Why? Because older adults do not just have one blood pressure. They have patterns. They have a morning pattern, a standing pattern, a post-meal pattern, a dehydration pattern, a medication timing pattern, a stress pattern, a nighttime pattern. And if all you know is that one office reading at 10:20 in the morning after sitting in a chair, you may completely miss the fact that the same person is dropping too low at home after breakfast, or getting weak in the afternoon, or spiking in the early morning, and then crashing once medication kicks in. That is why home blood pressure readings become especially important at 70. Not random readings taken in panic. Not 3 checks in a row because you saw a high number and got scared. I mean consistent, calm, properly measured readings over several days. Those patterns often tell the truth far better than one clinic number. Here is a simple way to think about it. If your blood pressure looks beautifully controlled in the office, but at home you are exhausted, unsteady, or your standing pressure drops sharply, then the treatment plan is not as successful as the chart suggests. On the other hand, if your office reading is a little higher than expected, but your home numbers are steadier, you feel strong, you are not dizzy, and your functioning is good, that story may be safer than the office would lead people to believe. Again, the number matters, but the pattern matters more than people think. And now I want to talk about what may be the most overlooked issue of all in adults over 70. Going too low on the bottom number. A lot of people have heard endless warnings about the top number, but very few have been told that in some older adults, especially those with stiff arteries or known heart disease, very low diastolic pressure can be a problem. If the bottom number is repeatedly falling too low, and especially if that happens alongside fatigue, chest discomfort, weakness, brain fog, or reduced exercise tolerance, that deserves attention. I am not saying every lower diastolic is automatically dangerous. I am saying context matters, symptoms matter. The heart does not care what the guideline says if the body is telling you blood flow is not being maintained comfortably. This is one reason why older adults sometimes say, my blood pressure is better than ever, but I feel worse than ever. That sentence should never be brushed aside because better on paper does not always mean better in the body. Now let's talk about the newer idea I mentioned earlier, the important finding adults on medication need to hear. The biggest shift in how we think about blood pressure in older age is this. Treatment success cannot be defined by seated office pressure alone. Not anymore. More and more, the real question is whether blood pressure is being lowered in a way the person can actually live with safely. In other words, standing pressure, variability, symptoms, and tolerance are not side notes. They are part of the outcome. That may sound obvious, but for years, far too many people were taught to focus only on whether the target number was achieved. But if the target is achieved while creating dizziness, low standing pressure, weakness, falls, or a diastolic pressure that is consistently too low for that individual, then the treatment is incomplete at best and harmful at worst. There is no trophy for having the lowest blood pressure in the room if you cannot stand up confidently. So what should you actually do if you are 70 and you want to know whether your target makes sense? First, pay attention to symptoms after medication. Do not ignore them just because your number looks better. Feeling faint, shaky, washed out, unusually tired, mentally cloudy, or off balance is data. Important data. Second, do not rely only on seated readings. Check what happens when you stand. Take your blood pressure after sitting quietly for a few minutes. Record it. Then stand up and check again within about 1 minute and again after a few minutes if needed. If your top number drops significantly and you feel lightheaded, that is something your clinician needs to know. It may suggest orthostatic hypotension, which becomes much more important in older adults. Third, track a pattern, not a single moment. For several days, check at the same times under similar conditions and look for consistency. Morning and evening readings can be helpful. Standing readings can be helpful. What you want is not one magical number. You want the truth of how your body behaves. Fourth, look at the full picture. Are you falling? Are you slowing down after medication? Are you afraid of standing up too fast? Are you avoiding walks because you feel drained? Are you having episodes of mental fog that seem to appear after your blood pressure got better? That information belongs in the same conversation as the blood pressure cuff. Now, I know some people hearing this will wonder, so are you saying I should just accept higher blood pressure because I'm older? No, that is not what I am saying at all. What I am saying is that once you are 70, the target should serve the person, not the chart. If your systolic pressure is persistently in the 150s or 160s, that deserves attention. If it is consistently elevated, that still matters. If you have diabetes, kidney disease, prior stroke, heart disease, or significant vascular risk, those details matter too. I am not minimizing high blood pressure. I am asking for something more mature and more precise than the usual lower is always better slogan. Because at 70, precision matters. The right question is not, can we lower it? The right question is, can we lower it safely, meaningfully, and without harming function? That is a much better question. And when you ask it that way, the answer becomes far more individualized. For many healthy, active 70-year-olds, a home systolic pressure somewhere in the 130s may be an excellent range if it is stable and well tolerated. For some, staying below 140 is the main practical goal. For others who are frailer, more symptom prone, or experiencing clear standing drops, chasing lower numbers may create more risk than benefit. In those cases, the better target may be the one that prevents both long-term vascular damage and short-term loss of stability. If I could summarize it simply, I would say this. At 70, the best blood pressure target is usually a range, not a commandment. A range that respects your symptoms, your standing pressure, your bottom number, your overall resilience, and your real-life functioning. That is the grown-up version of blood pressure care. And if you are someone who has been feeling worse since your blood pressure medications were intensified, please do not make the mistake of assuming that is just normal aging. Maybe it is. But maybe it is also a clue that the target was chosen from a chart instead of chosen for your body. That conversation is worth having. Bring your home readings. Bring your standing readings. Bring the list of symptoms you notice after medication. Bring the timing of when you feel worst. Those details can completely change the discussion because sometimes the most important line in the entire appointment is not, my pressure was 128/68. Sometimes it is, I feel unsteady every morning an hour after I take the pill. Or I nearly blacked out when I stood up yesterday. Or since my medication was increased, I don't feel like myself. That is not complaining. That is clinical information. And one more thing. If you are caring for a parent or spouse who is over 70, listen carefully to these subtle complaints. Older adults do not always say, I'm having orthostatic hypotension. They say things like, I just need to hold on for a second when I get up. They say, I'm probably just tired. They say, I don't trust the stairs like I used to. Sometimes that is weakness, sometimes balance, sometimes neuropathy, and sometimes it is blood pressure treatment that has become too aggressive for the body they have now. That is why context matters more with every decade. I want to leave you with the single idea I most want you to remember. The number on the blood pressure cuff is not the whole goal. The goal is circulation you can live on. Circulation that protects your brain without making you foggy. Circulation that protects your heart without making you weak. circulation that protects your future without stealing your footing in the present. At 70, that usually means being careful about pushing pressure too high for too long, but it also means being careful about pushing it too low for the wrong person. So if you came into this video believing that every 70-year-old should automatically chase the same target as a healthy 40-year-old, I hope you can see why the reality is much more nuanced than that. Your vessels are different. Your reflexes are different. Your risks are different. Your reserve is different. So your target may need to be different too. And if you remember nothing else, remember this. The safest blood pressure at 70 is not necessarily the lowest number you can achieve. It is the lowest number you can achieve while still feeling steady, thinking clearly, standing safely, and living fully. That is the real target. I'm Dr. Ava Carter. And if this helped you understand blood pressure in a completely different way, subscribe and stay with me. In the next video, I'm going to break down the warning signs that your blood pressure medication may be too strong for your age and what questions to ask before another dose increase is added. If you are over 70 or you care for someone who is, that is a conversation you do not want to miss.